This video provides general information about surgical exposure and bracketing of impacted teeth, also known as an exposure and bond surgery, including some of the risks, benefits, and alternatives to surgery. We are providing this information to assist in your decision whether or not to proceed with this surgery. Please note that not all of this information applies to every patient. For specific information about your diagnosis, treatment options, surgery, and recovery, be sure to ask your oral and maxillofacial surgeon. This video will cover what an exposure and bond procedure is, how to prepare for your surgery, risks associated with exposure and bond surgery, pain management options, and what to expect following surgery, including at-home care. Exposure and bond surgery is a team effort that includes you as the patient, your surgeon, and your orthodontist, all working together to design a treatment plan that meets your needs. When teeth are in a position where they cannot enter the mouth naturally, they are considered to be impacted. Treatment for impacted teeth may include the use of orthodontic braces to make space for the impacted tooth. For some patients, an impacted tooth will not move into a normal position in the mouth even if there is enough space for the tooth. When this occurs, the orthodontist will refer the patient to an oral and maxillofacial surgeon to assist with guiding the tooth into proper position with a procedure called exposure and bond. This procedure, which is usually performed in a surgeon's office, may require surgical removal of bone and removal or repositioning of the gum tissue to expose the impacted tooth. An orthodontic bracket and connecting chain will then be bonded to the exposed tooth. The chain and bracket will be used by your orthodontist to slowly guide the impacted tooth into the proper position. Orthodontic treatment time may vary depending on the degree of impaction. Your care team will provide you with specific instructions to help you prepare for surgery. A few common instructions include if you should take your regularly prescribed medications, the time to arrive for surgery, how long your surgery will take, and your discharge plans. Depending on the type of anesthesia you and your surgeon have decided on, you may be instructed not to eat or drink for at least 6 hours prior to surgery. Each patient's treatment plan is unique, so be sure to ask your care team about how to prepare for your surgery. While all surgery carries risk, your surgeon will try to prevent, minimize, and control these risks. Nonetheless, it is important for you to understand these risks before your surgery. Your surgeon cannot guarantee the results of the procedure, and the length of time needed to complete treatment may vary for each patient. With exposure and bond surgery, you may experience pain, swelling, bleeding, temporary bruising, soreness or cracking at the corners of the mouth, tissue scarring, damage to your lips, jaw, and teeth, including existing dental work, stress or damage to the jaw joint, or in rare cases, a jaw fracture. Infection can happen with any surgery and is often treated with antibiotics. However, some infections may require prolonged treatment, additional surgeries, or in rare cases, hospitalization. There are several nerves in your face, including those in your upper and lower jaws. Exposure and bond surgery, or the use of local anesthesia, can cause injury to these nerves. These nerve injuries can result in altered or loss of sensation, including loss of taste or numbness. Nerve injuries can also cause pain or altered feeling in the face, cheeks, lips, chin, teeth, gums, and/or tongue. Nerve changes after surgery may resolve over time, but in some cases, the changes may be permanent. Additional risks with an exposure and bond procedure include the bracket used to move the impacted tooth may come off and need to be reattached. The bracket, wire, and/or chain attached to the braces to pull the impacted tooth into position may cause irritation to the tongue, lips, or cheek areas. The impacted tooth may not move and may be left in place or may need to be removed. Rarely, there may be an opening created from the mouth into the sinus cavities. Or there may be changes in the condition and/or appearance of the teeth, soft tissue, or bone. Some of these complications may require additional surgery. Your surgeon will discuss with you the available options to control your pain and anxiety during and after surgery. During surgery, local anesthesia is used to numb the surgical site. The numbness from local anesthesia can last for a few hours after surgery and allows most patients the time needed to get home and start taking their pain medication before the numbness wears off. In addition to local anesthesia, you may be a candidate for other anesthesia options. IV sedation or general anesthesia may cause some patients to experience disorientation, drowsiness, nausea, vomiting, or allergic reactions. As with any anesthetic, whether performed in a hospital or an outpatient setting, these risks can be serious and in rare cases may even be fatal. After surgery, many patients effectively control their pain with over-the-counter pain relievers, such as acetaminophen, also known as Tylenol, or ibuprofen, also known as Advil and Motrin. Some patients may require stronger prescription medications like narcotics or opioids to help relieve moderate to severe post-surgical pain. Be sure to discuss your pain control options with your surgeon. For patients that receive IV sedation or general anesthesia, please be aware that these medications can have a different effect on each patient. Some patients may have lingering anesthesia effects, including memory and coordination issues, for an extended time, possibly into the day after surgery. Because your doctor cannot predict how you will react to IV sedation or general anesthesia, an escort must accompany you to the office, remain in the office during surgery, drive you home, and stay with you after surgery until the effects of anesthesia are no longer present. This is typically 4 to 8 hours after discharge from the office. It's important to understand that an escort is a responsible adult who can assist you after surgery until you are sufficiently recovered from the effects of anesthesia. You and your escort will receive instructions for home care and follow-up. Please be aware that if your escort is not available on the day of surgery, the surgery may be delayed, rescheduled, or completed with local anesthesia only. Once home, it is important for you to rest and follow the home care instructions. If you experience more than moderate discomfort, excessive bleeding, or have any post-procedure questions, you or your escort should call your care team for additional consultation and directions. For most patients, their diet for the first few days after surgery consists of soft foods that require little to no chewing. You may receive more specific diet instructions from your surgeon depending upon your specific surgery. This video provided a general understanding about exposure and bond surgery to assist in your decision whether or not to proceed with treatment. Each patient and their treatment plan are unique. You, your oral surgeon, and your orthodontist will work together to prepare a treatment plan that meets your needs. Please consult your oral surgeon if you would like further explanation about any information in this video, or if you have questions about your specific treatment plan or topics that may not have been included in this video.